Virginia Henderson was born into a large family of scholars and educators in Kansas City, Missouri in 1897. In 1901, her family moved to the state of Virginia, where she spent the rest of her childhood years and attended a boys' school managed by her grandfather. In 1918, spurred by patriotism and an admiration for figures like Florence Nightingale, Henderson enrolled in the Army School of Nursing situated in Washington, D.C. After a 2-year program at Walter Reed Hospital caring for wounded World War I soldiers, Henderson received her nursing diploma. She worked at a variety of hospitals and eventually returned to education at Columbia University in New York City. In 1931, she received her Bachelor's of Science, and directly after that completed a master's program in nursing education. During her time at Columbia University, she revised Bertha Harmer's textbook of the Principles and Practice of Nursing that was widely adopted by nursing education programs. Henderson worked as an instructor at Columbia University, later taking a position at Yale in New Haven, Connecticut. Here she acted as a researcher. Over the years as an educator and researcher, Virginia Henderson redefined the role of a nurse and published her own book titled The Nature of Nursing, in which she expressed what she called her concept of nursing. Henderson claimed that a nurse has 14 specific activities that need to be performed in order to provide excellent care. Those activities are maintaining normal breathing, maintaining adequate eating and drinking, the elimination of bodily wastes, maintaining desirable posture and position of the patient, helping them get sleep and rest, picking out clothes, dressing and undressing, maintaining body temperature within normal range, keeping the body clean and well groomed, maintaining a safe environment and preventing injury to the patient and others, helping the patient communicate with others, worshiping according to one's faith, helping them accomplish work tasks, playing or providing forms of recreation, and using resources to provide learning, discovery, and healing. As we can see, these are all nursing activities that a modern-day nurse performs in one way or another. Henderson went on to explain that the nurse performs these activities within 3 different types of roles, the first one being doing for the patient. In this role, the nurse performs all aspects of the activity. In a modern-day setting, we could see a nurse performing oral care on a conscious or unconscious patient, one who doesn't have the strength or the capability to do it themselves. The next role that Henderson describes is that of helping the patient. In this role, the nurse performs only that which the patient cannot. In today's setting, we may see a patient trying to dress and undress. They may be able to perform part of the activity but not complete the activity by themselves. This would be a case of the nurse helping the patient. The third role that Henderson describes is that of working with the patient. In this role, the nurse plays more of a teacher. The patient actually performs the activity themselves. In a modern-day situation, the nurse may be teaching the patient how to take a medication or clean a wound, and the patient actually performs the activity themselves. This would be working with the patient, according to Henderson. Virginia Henderson's teachings became widely adopted as standard nursing practice. Many went on to call her the Nightingale of modern nursing. She received 13 honorary degrees. She was inducted into the American Nursing Association's Hall of Fame and had a library named after her. Virginia Avenel Henderson died on March 19, 1996 at the age of 98. She redefined the role and duties of the nurse, and will be remembered as the one who led the way to modern nursing.